The common iliac artery gives rise to the external iliac artery and the internal iliac artery. Branches from the internal iliac artery include the obturator artery, the internal pudendal artery, and the superior and inferior gluteal arteries. The obturator artery arises in the pelvic region. It descends via the obturator canal to enter the medial thigh. The internal pudendal artery exits and enters the greater and lesser sciatic foramen respectively. The gluteal region is largely supplied by the superior and inferior gluteal arteries, entering the gluteal region via the greater sciatic foramen. The superior gluteal artery leaves the foramen above the piriformis muscle, the inferior below the muscle. In addition to the gluteal muscles, the inferior gluteal artery also contributes towards the vasculature of the posterior thigh. The external iliac artery gives rise to the deep circumflex iliac before it becomes the femoral artery. The femoral artery crosses under the inguinal ligament and enters the femoral triangle. Once the femoral artery enters the femoral triangle, it gives rise to three branches: the superficial circumflex iliac, the superior epigastric, and the external pudendal. After these branches, it divides into the profunda or deep femoris artery and the superficial femoral artery. The profunda femoris artery arises from the posterior lateral aspect of the femoral artery. It travels posteriorly and distally, giving off three main branches. Perforating branches consist of 3 or 4 arteries that perforate, contributing to the supply of the muscles in the medial and posterior thigh. Lateral femoral circumflex artery wraps around the anterior lateral side of the femur, supplying some of the muscles in the lateral side of the thigh, giving off 3 branches: the ascending, transverse, and descending branches. Medial femoral circumflex artery wraps around the posterior side of the femur, supplying the neck and head of the femur. In a fracture of the femoral neck, this artery can easily be damaged, and avascular necrosis of the femur head can occur. The acetabular branch of the obturator artery can also be damaged with this injury. After the medial femoral circumflex artery exits the femoral triangle, the femoral artery continues down the anterior surface of the thigh via a tunnel known as the adductor canal. During its descent, the artery supplies the anterior thigh muscles. The adductor canal ends at the opening in the adductor magnus, called the adductor hiatus. The femoral artery moves through this opening and enters the posterior compartment of the thigh proximal to the knee. The femoral artery, now known as the popliteal artery. The popliteal artery descends down the posterior thigh, giving off genicular branches that supply the knee joint. These branches are as follows: the medial superior genicular branch, the lateral superior genicular branch, the medial inferior genicular branch, the lateral inferior genicular branch, and the middle genicular branch. The sural branches also come off of the popliteal artery. In addition to these arteries off of the popliteal artery, there are other arteries that contribute to the anastomosis of the knee. They are as follows: the anterior recurrent artery off of the anterior tibial artery, the circumflex fibular artery off of the posterior tibial artery, the descending genicular branch off of the femoral artery, and the descending branch off of the lateral femoral circumflex artery. The other terminal branch of the popliteal artery is the anterior tibial artery. The anterior tibial artery passes anteriorly between the tibia and fibula through a gap in the interosseous membrane. It then moves inferiorly down the leg. It runs down the entire leg, where it gives off the medial and lateral anterior malleolar arteries before it turns into the dorsalis pedis artery in the foot. The arterial supply to the foot is delivered via 2 arteries: the dorsalis pedis, a continuation of the anterior tibial artery, and the posterior tibial artery. The dorsalis pedis artery begins as the anterior tibial artery enters the foot. It passes over the dorsal aspect of the tarsal bones, where it divides into the medial and lateral tarsal arteries. The arcuate artery, which gives rise to the second, third, and fourth dorsal metatarsal arteries, and the first dorsal metatarsal artery off of dorsalis pedis. Dorsalis pedis then moves inferiorly towards the sole of the foot. It anastomoses with the lateral plantar artery to form the deep plantar arch. The dorsalis pedis artery supplies the tarsal bones and the dorsal aspect of the metatarsals. It also contributes to the supply of the toes. Please note, on the dorsal aspect of the foot, that sometimes the dorsalis pedis can give rise to the artery to the sinus tarsi. Another variation on the dorsal aspect of the foot, sometimes people do not have the dorsalis pedis artery and instead have a perforating branch from peroneal. The posterior tibial artery enters the sole of the foot through the tarsal tunnel. It then splits into the lateral and medial plantar arteries. The medial plantar artery has two main branches, superficial and deep. The deep branch gives rise to three superficial branches that anastomose with the three medial plantar metatarsal arteries. The lateral plantar artery courses medially and anastomoses with the deep branch of the dorsalis pedis. It gives rise to four plantar metatarsal arteries and the superficial branch going to the fifth digit.